The prostate is a gland found only in male. It makes a fluid, is part of the semen fluids. Prostate cancer started when the cell of the prostate gland grow uncontrollably. Risk factors of the prostate cancer are the age, that's mean 80% of the prostate cancer diagnosed in 65 years old men or older. The second risk factor is family history. That's mean if a man has a first degree relative who has prostate cancer, his risk average to have a risk cancer is 2 to 3 times more than the others. The last risk factor is the diet. High fat dietary contributing risk factor of the prostate cancer.
Prostate cancer are without any symptoms. Most of the men will experience symptoms like urgency, that is rushing to the toilet to pass urine, frequency, that is frequent passing of urine, then difficulty in passing urine, interrupted stream, etc. If it involves the bladder base, there can be predominantly urgency, frequency and incontinence of urine. But if it involves predominantly the lymph nodes, there can be lower abdominal or abdominal masses. Then there can be edema of both feet, swelling of both legs, etc.
The treatment options for carcinoma of the prostate or cancer prostate depends upon the type of tumor, the extent of spread of the disease and the general condition of the patient. In elderly patients, say more than 75 years of age, with a low-grade tumor which is spread or limited to a small portion of the prostate, a treatment option called active surveillance, where we do not interfere effectively or just follow up the patient, is very much sufficient, because in such patients the spread or rate of tumor is so slow that it is unlikely to cause problems during the natural lifespan of the patient. In patients who are younger or with higher grade prostate tumor which is limited to the prostate alone or within the immediate vicinity, they are potentially amenable for cure. And the curative option includes the surgery which is called radical prostatectomy, involving excision of the entire prostate gland. In patients who are unwilling for surgery or who are medically unfit to undergo surgical procedures, a targeted conformal radiotherapy can be equally effective. Nowadays, newer modalities of treatment are being developed for patients who do not respond to the currently available first-line treatments for prostate cancer.